One.
Good morning and welcome everybody to the Send Question and Answer live session. It's good to have you all with us this morning. Thank you for joining us, and thank you to everybody who's contributed in advance of the session this morning. If we go to the next slide, my name is Judith Mobbs and I'm the Assistant Director for Inclusion and Skills at Suffolk County Council, and I'm going to be the continuity person for this morning's session. The first thing that I'd like to say is that we do realise that this is a difficult time, and we want to be as helpful as we possibly can in this time. So I'm just going to run through quickly what the session's going to cover this morning, but it's mainly focusing on our next slide. It's mainly focusing on the areas that you're interested in. So I'm going to talk briefly about returning to learning and some of the things that we've put in place to support you. And then we have received several questions from families and parents this morning. So those questions and answers will be addressed first. And then we'll provide a space for further questions. So if you've got a question that you don't feel has been answered this morning in the event that you'd also like to hear about, there's going to be a space later on this morning for you to ask that, and we'll do our best to answer it. Any questions we don't answer during the live event, if we get several questions at once, we'll post some answers later on for you. So don't worry, your question will be answered. And there'll also be a summary at the end about the additional ways that you can get support at this time when you're supporting your children or young people to return to learning. So if we can move on the slides to start talking about the return to learning, what is available already. So we recognise that there are going to be all sorts of questions about supporting your child or young person back into learning. So we have set up a parent carer helpline so that you've got an opportunity to ask any questions that you want. They might be about transport, they might be about attendance, they might be about the way that your school is responding, the kind of offer that you've that's being made by the school. It could be something about an education, health and care plan. So the parent carer helpline is there for any questions you have and will be available throughout September. You'll see there's on the slide that's up on the screen at the moment, there are links, and we will send these slides out by email and post them on our Facebook and local offer pages after this event. And if you click on those links, you'll have access to the helpline. Our local offer information pages will continue to provide up-to-date information about all the different kinds of support that are available to you. So going to those local offer pages is also a good way to get the support you need. And you might have already come across the 5 Tips for Families series that we've been running throughout lockdown, working in partnership with the Suffolk Parent Carer Network. And those 5 tips for families, I think there's some really useful information in there provided by our psychology and therapy services. And there are some tips for things like sleep, tips for getting back to school, tips for supporting children or young people who have autism or who have anxiety. So all sorts of things in there. So do go and have a look at those as well. So that's the package of support, additional support for parents and carers. In terms of schools and practitioners, we also recognise that this is going to be a challenging time for school teachers and all staff in schools, and we want to support them to be able to support your children back into school as smoothly as possible. And so we've also set up a helpline for our Senkos. So Senkos will be able to phone in every day between certain hours to get support and answer questions that will enable a child with anxiety to be better supported, or the adaptations to be advised for perhaps somebody with autism. And in addition to that, we are increasing the number of consultation slots that we're making available for Senkos so they can get more detailed support earlier. There's a question later on about EHC risk assessments and the kind of support that you should be expecting to make sure that if your child has a plan, they're getting a full offer, and what happens if their offer's being stepped up gradually and when you should expect a full offer. So I won't say any more about that now, but all of that is part of our package to support you to help your child or young person get back to learning. So we're going to move on to the questions now. And I'm going to introduce people and invite them to answer questions that are in their field of expertise. So if we move to the first question that we have this morning, which is question 1, and I'll introduce to you Izzy Connell, who is our Head of Specialist Education Services. So welcome, Izzy. Would you like to share the first question and your answer to it? I think, Izzy, you might be on mute. So we've all done that, haven't we, during these kind of events?
Sorry,
so if you
somebody had to do it first, didn't they?
That's all right. Izzy, welcome. I can see you now in your lives.
Start again.
So welcome this morning. And
thank you. Thank you. It's good to be here. Thank you, everybody. So the first question was, how will the local authority ensure children are appropriately supported when they return to school, given the current guidelines? I think firstly it's important to say that schools aren't suddenly opening from the 1st of September. As you know, most schools have been open since the start of lockdown and are now quite well accustomed to risk assessing what they need to do to make sure they can receive children back into school. I know there's been lots of head teachers, lots of SENCO school-based staff working incredibly hard over the lockdown period and over the summer holiday to get their schools ready to open. I think you'll know that the government guidance is that all children will come back from the 1st of September. So schools have been working on the basis that it's back to normal, all children attending school from the start of term. So when they return, there will be a risk assessment in place from each school as to how they are opening for all children safely. And those risk assessments will concentrate on a number of areas, not just the physical reopening of the school. It may be that schools have decided that they need to do staggered start and finish times to avoid too many people being in one place at the same time. There may be that your children will enter and exit the school building by different routes. The school obviously will look quite different when they go in terms of, you know, there'll be tape here and there, there'll be guidance around the building as to how they should minimise the risk of transmission of the virus. But most importantly, it's been recognised that children need to go back to school now and start their learning again. The curriculum will be full and broad in the normal way, but it may be that for some children there will be a focus on some catch-up time with English and maths or whatever it might be. But the basic guidance is that they're back to a full curriculum as soon as possible. Children will be working in bubbles. The size of the bubbles will be dependent on the school that they attend, from class bubbles to year group bubbles. There will be quite a lot of being outdoors as much as possible. I know schools are trying to do some outdoor learning outdoors at break times as much as possible, and trying to keep children in ventilated areas as much as they possibly can within the context of their setting. In terms of the return to school from the local authority, we are expecting to support children very much in the same way that we have been doing since the start of lockdown. Some of our work will still be virtual with children and with schools. Some of it will be face-to-face visits. It will be very much on a needs-led basis and on a risk-led basis. But where we can be working virtually to support children, we will, to minimise risk. But we will liaise with each school and work around each school with their risk assessment to decide what is best for that child, keeping the child very much at the centre of any decisions we make. Judith's already spoken about the parent helpline. I hope that will be useful to you if you have any concerns as your children go back to school this week. And Judith's already mentioned the Senko line, which is there for quick questions, quick queries, links to colleagues across the inclusion service and across health if there's any questions from Senkos in school or leaders of SEND in school about children's return. So we hope there's plenty of support in place, but do use that parent line to contact us if there's anything else that we can help with, or anything that you feel when your child goes back to school you need to ask the local authority a question about. Thank you, Judith.
Thank you, Izzy. That's really helpful, and hopefully that's given people a good idea of how it will be when children go back to school. We're going to move on to the second of our 8 questions that we have put together for the event, and I'd like to introduce Tracy Winwood, who is our Head of SEND Services for Children and Young People and Families, to answer this question. So thank you very much, Tracy.
Thank you, and good morning, everybody. So this question focuses at individual level. So what happens if we have not received a transition plan or a risk assessment for our child? So Izzy talked about a risk assessment in terms of the risk assessments that schools have completed in order to facilitate all children back to school. This, I'm assuming, talks more specifically about an individual child. So for some children, whilst schools are working, have been working tirelessly over the summer to ensure they get as many children back to school as possible, for some children that will mean there will be some phased integration over the next few weeks. And if you're unsure about what the transition plan is for your child, or why your child can't return to school immediately full time, and you don't feel that you've had the information that you need from the school, then please talk to them. Please talk to them about that, and they will explain what their plans are, whether what their risk assessment has been, you know, why they put in the plans that they've put in place. So always, please talk to the school. They will be the people that will have that information. In terms of if you're still not satisfied with the response that you're getting, or you're still unsure, then as we've already talked about, the Parent Carer Helpline might be a resource for you. You can call, raise the questions, and we will facilitate that discussion with the school to understand that. Or, you know, or and offer advice and guidance to them, or, you know, they may also access the Senko helpline if that's a question that they need to do. For our children with education, health and care plans, way back now in April, we asked school education settings to complete a risk assessment of their children with education, health and care plans. And the part of that risk assessment was assessing about whether it was safer to have children at home with their families, or whether they were safer in school. And also, you know, how the schools were making the support and education available that the children had in their education, health and care plans. Now, the government have highlighted that that tool might be useful during the autumn to support children back to school. And whilst we were required back in April, a school to complete that for every child with an education, health and care plan, for the autumn, we will be asking that all schools and education settings for whom a child with an education, health and care plan will not be back in school by the end of September, they are required to complete a risk assessment and submit that in detail to us. Now, that risk assessment should be completed with you as families or our young people, and also any key professional supporting that child. So, for example, we have some children with really complex health needs, it's not safe for them to return back to school at this moment in time. That risk assessment has been undertaken with those health professionals that are working really, really closely with that child and others. So it's not we're not expecting there to be a blanket policy around children with a group of needs, but it's about individual children, individual situations, and that may also be dependent on the school context. Yeah, so I hope that helps you. Remember, talk to the setting first. Can use the parent carer helpline. You know, if your child's not coming back into school yet, you know, ask school about risk assessments. What's the plan? When will they be back in? And ensure that there's a clear plan. Thank you very much.
Thanks, Tracy. That's really clear and much appreciated. Now, several parents have been raising concerns about children returning to school and the impact of COVID and return to school on mental health and anxiety. And we recognise that this is going to be a really significant issue for children and young people who perhaps already were anxious about school attendance. So on that basis, we've got one or two questions coming up now that relate to that particular area. So back to you, Izzy, for a school-based question, first of all. Thank you very much.
Okay, thank you. So the question this time was, what plans are being made to ensure children have a successful return to learning in terms of their mental health? Will blended learning be an option? So we know that, again, over the lockdown period, and especially with the full return to school in September, that mental health has been a real focus. It's a national focus and it's a local focus. It's a national focus to the degree that there is actually a well-being programme being put together by the Department for Education and funding being made available to support children's well-being on their return to school. And that's a big project that's being looked at the moment, and our psychology and therapeutic services are very much involved with that, alongside our colleagues in education and learning. In terms of what that might look like in school, is there will be and should be a real focus on settling children back in, making sure that they have opportunities to talk about what lockdown has been for them, making sure they can talk about what their summer holiday has been like for them. So there is a gentle start to school, and they have chance again to be with friends, get used to each other, get used to their bubble, get used to the new routines and structures that there will be around school. And again, we know that schools have been working really hard on this because they know that children will face perhaps a slightly different school when they come back in September. In addition to what schools are doing within the context of their own settings, there's been many resources made available on the local offer. Please do have a look from many of our services, particularly our psychology and therapeutic services, but also our specialist education services, about supporting children's mental health as they return to school. A number of those very good resources have been shared with us by our CENDIAS and SPCN colleagues as well, for which we're very grateful. So please do have a look at the local offer and the CENDIAS website, where you'll find a wealth of resources about supporting children's well-being and mental health coming back into school. There's a lot of external mental health support for school. The school have access to primary mental health workers. Our services, particularly our SIS service led by Sally Blackman, will be carefully looking at children who need some additional support because of their communication interaction or SEMH difficulties, and we're aware that we need to be ready to support those children where schools contact us to say there are some children that are struggling perhaps more than others. We've got services where there is ELSA trained members of staff, that's emotional literacy in schools, and the psychology and therapeutic services will be aware that we may need some additional resource around some ELSA work with schools as well. We have a number of SENCO forums coming up and SENCO CPD sessions, where we'll also be looking at the issue of mental health in schools with SENCOs and working with colleagues across services across health and NSFT to present to SENCOs what the service offer is. In addition, the question around blended and online learning, it's expected that children will attend school full time. So we would only expect there to be a blend of online learning if, for a couple of reasons. Firstly, we know that there are a number of children with highly complex medical conditions who may well only be able to attend school part-time and therefore need a blend of online learning, but they are a very few children with very, very complex medical needs. The other reason it might happen is, of course, none of us can predict whether there might be another spike in virus transmission, in which case schools are well set up now to deliver online learning if at any point they need to, or if they need to around individual children who may have to self-isolate as per government guidance. Then remote learning now has become something schools are accustomed to providing. But again, if you have any questions around any remote learning for your particular child, then please do use the Parent Carer Helpline and we'll be able to help you with any questions around individual children. Thank you.
Many thanks for that, Izzy. And continuing on the same theme of supporting families where there's a child with anxiety, we've had a lot of parents ask us about attendance and the attendance regulations. So I'm really pleased to be able to introduce Stuart Hudson, who leads on our attendance service. Welcome, Stuart. And I'm just going to remind you, Stuart, to turn your mic on so we can all hear you.
Good morning, everyone. Thank you very much for coming to this webinar this morning. Obviously, it's been over the last 6 months, it's been a very difficult time for lots of people, not only children, but also families. And the process that we're looking for schools to take, and they've been asked by government, is a very much a supportive and nurturing approach to help children back into school. The question in itself isn't always a yes and no answer. Each case will have to be dealt with on its merits, and we are really encouraging schools that they should look at all the barriers that are in place for children and their families to get children back into school. What we would like to see is very much a process whereby if there is an issue, families contact their school initially, or if they wish to, they can contact the school attendance service, and we will then work with the schools to see what can be put in place to help these children and reassure families that it is safe to go back to school. Long term, we want our children to be in school. We want them to be able to receive the education that they are entitled to and that they deserve, and giving them the best life chances that they possibly can. Where there are difficulties, we will look to work with the schools to remove the barriers, and it won't be that we will go straight to a prosecution. Each case, as I said, will be looked at on its merits. We're really not looking to force children into the legal arena or their families at this stage. It's going to be a long time, we think, to get back to school, and we need to continue to be supportive. Schools need to be supportive and nurturing to help children as best we can. I think at the end of the day, we will just continue to work with you as parents and carers, and also the schools, to do the best for your children. And I think at the end of the day, that's all I can say at this stage. each case will be taken on its merits. Thank you.
Thank you very much, Stuart. I think your key message there is very much talk to people about it, talk to the attendance service, talk to the school, and through talking it, we can understand what the issues are and put in place an appropriate plan, recognising that everybody's had a different response. Would that be fair to say?
Yeah, that is fair. There isn't a one-size-fits-all process for this, and each case will have to be looked at.
Thank you, Stuart. That's really helpful. I hope that reassures people who are a little bit concerned about that. And I'm going to move us on now to the other real hot topic where we've had a lot of questions, and that is school transport. And I'd like to welcome Tracy Vobe, who is the person who has the unenviable task of being head of our school transport arrangements as head of passenger transport, and I'm really delighted you could join us this morning, Tracy, to answer questions about transport. Thank you. So over to you for this question.
Thank you, and good morning, everybody. So the question is, what is happening with home to school transport and social distancing / masks? So I just wanted to say, you know, there has been a huge amount of work that's been happening over the last few months. This is always our busiest time, and it's been even busier than ever. And things have been changing, which has been difficult. So over the last few months, things have been changing and changing what we need to do. However, on the 2nd of July was the first government guidance that came through us that said to us that no social distancing needs to happen on those dedicated closed contract vehicles. And obviously many SEND students will be travelling on dedicated closed contract vehicles. So just to confirm, from social distancing, it's not required on vehicles. And about face coverings, on the 11th of August, we were told that on dedicated closed contract vehicles that face coverings were only recommended. So it's not essential. Obviously, it's for those students that are age 11 and over. And obviously, there's all the exemptions as well that apply to students and young people. So it's worth, I've put on the links, just in case you're not sure, that there is the list of exemptions that do apply. But I just wanted to say that for many dedicated closed contract vehicles where students are travelling to special educational schools, that the drivers and passenger assistants will be asked to wear a face mask. So a bit of added protection that the unions wanted to add in to the risk assessments for the schools. For those young people that are travelling on a public transport vehicle, you know, a big bus, because many have been travel trained, the normal face coverings is mandatory, so you will have to wear them on those. And I know there are some young people who can travel independently on their own on a school bus. But obviously, if there are any issues, then as the team have already said, to contact the helpline, and we'll follow through those concerns that you've got. I think that's probably all I need to say at the moment, Judith. Is that okay?
Thank you very much, Tracy. That's brilliant. If anyone on the line, on the call, has got some specific questions, then the place to post those is in the question and answer panel that you have available to you. I put a note in there that hopefully will have drawn your attention to it. And I can see we've had one person has asked a question, so thank you for that. We will cover the questions that have been asked at the end of the session. So if anyone else wants to ask a question over the next few minutes, please do post it in there, and then our team will have a look at it, and we will respond to you as best we can. So many thanks for that, Tracy. And from one Tracy to the other Tracy, we're going back to Tracy Winwood, who's going to pick up the next two questions. Thanks very much, Tracy.
Thank you. So this question, what steps should the council take if EHCP provision is not being made? This is something that we asked about in the risk assessments back in April, about because schools had to be creative about some of the delivery of the provision that's written. So the provision or support that is written in an education, health and care plan, which is section F. So as you know, my previous answer actually, first step, always talk to the provider. So if it's about, you know, a provision or support that you're expecting to see in school and that's not happening, then please ask those, you know, go back, talk to your Senko or the class teacher and ask them about support. Often this can be easily resolved, or sometimes it's just a misunderstanding about what is or isn't being provided. However, if you then feel that you're not getting the answer that you're expecting, or that you know the school is saying that they can't, they don't know how to put the provision in, so then is to raise that with our family services team. So our family services team are the team that look after all children and young people with education, health and care plans. And it's a matter of contacting them, explaining, you know, what your concerns are, what conversations you've already had, whether there's been any agreed actions, and then we will pick that up and follow that up for you. Sometimes your question might be around a health service or a care service or support that you're expecting to happen. Again, we'd encourage you to talk to the health provider. So if you've got speech and language therapist that is working with your child, have a first conversation with them. But again, I'm not asking you to go lots of different routes. First come to family services, talk to us about that. We will make contact with the health provider or the care provider as well, have that conversation. Now, when we do start to understand your concerns, and we are then going back to the providers, if we can't reach support or we find out what the problem is, then we will be offering advice or guidance perhaps to the provider. So if it's a school and they're not sure about how they will put in education provision, so perhaps a specific literacy programme, for example, we might ask the services that sit with Izzy if they can offer some advice and guidance to the school around specific literacy programmes. Or if it's a funding thing, we might offer them advice and guidance about funding. So we will then always come back to you to confirm what action we've taken, what the outcome of that action will be. As always, if you're not happy with that response, you have the right to raise your concerns formally, and that would be with whichever element of the service that is. But we would very much hope that in 99.9% of cases, we're able to support you in reaching a satisfactory resolution if there is not provision being delivered. Thank you. Now, I think we may have hopped a question there, so I'm not sure if we're coming back to it. Oh yes,
we certainly are, Tracy. If you'd like to do question 6 now, I think it was just to keep you on your toes this morning.
Yeah. So another question that's come in again around children and young people with education, health and care plans is how will you support children with education plan, health and care plans with regard to confirming appropriate new placements for the academic year 2021-2022. So for next September. Feels a long way off, but for all of us that have been recent, we know how the months can leap past. So as always, we don't see there being any difference. So family service has been operating as a business as usual service. And so we see the same with regards to you choosing schools for your children and young people choosing their next provision at post 16 in the normal way. So you would be expressing preferences, requesting, submitting applications for schools for next September. We will, many children in transfer years, you may have been involved in some annual reviews last term, and often some of those will have been virtually. And then there may be some more this term. Some may be face-to-face meetings, but some may again be virtually. So in a conference call like this or over the telephone, schools have been really creative in how they've been able to engage with you as families. And through that process, we will amend any education, health and care plans that require amendments. We will consult with both your preferred and, and sometimes you might think a school would be good for your child, and we may have some new provision coming along which might also be good. So we will talk to you about preferences, we will consult with education settings, we will come back and advise you as to the school that we feel is most suitable for your child, and ultimately we name that school for next September. For year sixes, so those children in year 6 or even those children in year 2 that are moving on to junior school, the education, health and care plan will be amended, naming the school for September and February. And for our year 11s and other post-16 children and young people who are moving on, that would be the end of March. So it's business as usual. But if you've got any concerns about placements, then again, speak to your local STEM Family Services team. Thank you.
Thank you very much for that, Tracy. That's really helpful. So we'll skip back on to question 8 now, please, having done number 7. So question 8 is our last question that we've put together before we actually look at the questions that have been shared by other people during the call, for those of you that were on the call. And I'm going to introduce Julia Granger, who's our Head of School Improvement, to begin the answer to this one. And then I think, Julia, you're going to bring Izzy into the call as appropriate.
I am, yeah. Good morning, everybody, and thank you for this. Thank you for sending the question in as well, which is obviously something which is on children's mind, young people's minds, teachers and head teachers' minds and parents' minds too. Firstly, to say that when children and young people return to school at the start of this academic year, many of them may not be at the place in their learning where they anticipated they would be at the start of the year. But also just to reassure that over the last few weeks and months, head teachers and teachers will have been really carefully planning the learning that needs to be in place to best meet children and young people's needs at the moment. And they'll be continuing to do that over the coming weeks and months. And that's actually the bread and butter of teachers and head teachers' roles. It's looking at where are children in their learning, what is it they need to learn next, and then adapting the teaching and the curriculum to meet those needs. And so they'll be carrying on doing that based on their knowledge about where your children are in their learning, from what they see, from what they hear, and from the children's work. So if you do have any concerns about it, as Tracy said earlier and Izzy said earlier, the most important thing is to talk to your child's school about any concerns that you or they have. There is flexibility in the curriculum to meet the children's needs. So teachers and schools will be adapting the curriculum to meet where children are when they return to their learning full time this term. As you'll also know, there was a £1 billion catch-up programme which was announced by the government earlier this year, and that includes £650 million which will be going into schools. It's on the basis of, we're told, £80 per pupil in mainstream schools, £240 per pupil in specialist schools or alternative provision. And schools will be looking at that fund and thinking, what's the best way of using it to help children and young people catch up in their learning? There is some guidance around that school leaders can use when they're making their decisions about how to use it, and the Education Endowment Foundation guidance, which shows a lot of interventions, how they work, what they're used for, how well they help children and young people catching up. They'll be able to use that guidance as they're planning how to use this catch-up money that they have. There'll also be the National Tutoring Programme, and we're waiting for finer detail about that. That's due out at the end of October, early November, when schools will be able to use some of their funding to support one-to-one tuition or small group tuition in their schools too. So just to reassure, the autonomy for planning the curriculum, designing the curriculum, making sure it meets the needs of your children rests with school leaders and with teachers, and we'll be working with them over the coming months and weeks to make sure it best meets the needs of your children as they return to school. I'll hand over to Izzy Connell now to talk a bit more about any further information.
Thank you, Julia. Yes, so it will be very much down to the school as to how they use their catch-up premium and how they go ahead with the national tutoring programme for individual children. But as Julia said, there will be a time needed for teachers and senior leaders in school to do some sort of both formal and informal assessments of where children are at with their learning, but making sure again that the children settle into school and that they're happy and that they're safe. That will be the priority, but inevitably there will be some measures put in place to try and assess where the children are compared with their starting points at the start of the year, and what needs to be put in place then for them to catch up. And that will be very much led by the needs of the individual child, the needs of perhaps an individual group of children in school. And obviously we'll be working with schools around how they are managing and using some of this additional resource with individual children in school through the visits from our specialist education services. We know that Ofsted will ask visits, will ask questions rather, around how this extra resource is being used in school too. But it's very much there to support individual children. And again, you would be completely within your rights to ask in school what is being put in place for your individual child with additional needs. Thank you.
Thank you very much, Izzy, for rounding off the answers to the questions we've received beforehand. And thank you to everybody who has submitted questions. We had obviously several questions on a similar vein, so we wrap those all up into those 8 themes that we've just answered questions for. But I can see that we've had a couple more questions come in during the presentation, and now is the slot where we've got a few minutes to answer questions that have come in from people that are participating in this live event. So I'm going to ask you, Stu, to pick up the first question, which is about flexi schooling. So if you'd like to answer that for us, that would be brilliant.
Yes, quite happy to do that. Just to let everyone know, flexi schooling is an option, but it's legal in the UK to ask for it. And just in case some people don't know what flexi schooling is, it's a mixture of learning at school and also then learning at home, and you may be able to use school resources. What the main issue is that flexi schooling, although it is legal in the UK, it is not an automatic right as access to a full-time education is, and it's entirely at the discretion of the head teacher for the school where your child goes. You need their permission before you can go ahead and do flexi schooling. Flexi schooling may be an option, much like part-time timetables, where they're seen as a progressive measure to get the child back into full-time education. And I think what needs to happen is each school needs to be approached to speak with the head teacher to decide whether flexi schooling is the right process for you and your child. But be warned, it is not an automatic right, and they can insist that you be there full time. But a part-time timetable may be an option with a view to moving to full time over a number of weeks. I hope that has answered the question about flexi schooling. Thank you.
Stu, thanks very much for that. I'm sure that that's clarified things. So first step is to talk to your school about that. And I guess as with anything else we've raised this morning, the parent carer helpline for families with children with additional needs will be open throughout September, and that's another avenue as which parents can ask questions which will be directed to your team if necessary, or they can ring the attendance team directly. So thank you for that, Stuart. The second question we've had this morning is, my child is on an EHC plan and still in mainstream and goes out to groups to others things averaging year 1 and 2 stage. How will this happen if only in bubbles? So it's the complex question about bubbles. I'm going to ask Izzy and Julia to come in on this one. Izzy, I think you're going to start us off, but please, either of you, if you can help us with the bubbles question and children moving between groups or going into small groups for some activities. Thank you.
Thank you. Yes, it's a good question, and I know it's one that lots of schools have been thinking about how they manage that because of managing bubbles and children not moving around as much as possible. The school's risk assessment would cover issues like staff moving between and in between and across bubbles. We know that there's a number of schools that are organising for teaching assistants to be within a bubble where they need to support an individual child or a group of children. It must be remembered that not all children need to actually be removed from a classroom to receive their intervention. They can receive intervention in their classroom. The idea of any intervention is that it's transferable back into a classroom. So schools will be managing it in different ways, and I think if there are very individual concerns, we would urge you to ask the school what their risk assessment says about children with an EHCP and delivering that intervention. But they will have considered that as part of their risk assessment for safety for all children, but also as part of any risk assessment around children with additional needs and how they will deliver that. As I say, at the moment, in terms of talking to schools, it's likely that there'll be teaching assistants attached to bubbles. In secondary school, it's more likely that the children will stay in a bubble or in bubbles across their year group, and the staff will go to them. And I think it's recognised that children will need additional support, and a teaching assistant, for example, may need to work more closely with a child. The other factor is the geography of the school or the infrastructure of the school. Is there a safe space where a child could work one-to-one with a teaching assistant? And again, that would be part of a school's risk assessment as to where they can provide that additional intervention. So we would urge you to talk to the school. What is your school able to do to support my child with their EHCP? Do use the parent helpline if there's questions, further questions arising, so that we can sort of support you around individual cases and individual questions. But it will be part of the school's risk assessment as to how they deliver interventions as part of an EHCP. They may have to be more creative about how they do that, but we know that they will have to have covered that within their risk assessment. Thank you.
Thank you very much, Izzy. That's great. And thank you to everybody who has contributed. I just want to check with Julia. Is there anything you wanted to add about bubbles, or has Izzy covered that?
Thanks, Judith. I quickly turned my camera off there, but turned it back on very quickly. I'd just reiterate what Izzy said about to talk to the individual school, because obviously all schools are very different buildings, different setups, but they will have been thinking through all these scenarios in their risk assessments over the last few weeks to make sure that they're planned for the children to have what they need and what they deserve in a safe way.
Thank you very much. That's brilliant, Julia. So we've come to the end of our question and answer session for this morning. But we've got one final part to complete it, which is a summary of the support that's available. And I'm going to introduce Carol to you in a minute, who's going to lead us through that. But just before I do, I want to say that all of the information on the slides this morning will be available to you via email, including all the information Carol's just going to go through. And we will also make a recording of this live event available, because I'm conscious that there might be things you want to listen back to, or there might be friends who are interested in listening to parts of this webinar who perhaps weren't available to attend it this morning. So we will make sure that all of this information is widely available after this event, because there's been a lot of really useful information packed into a very short period of time, and I'm conscious of that. So just to conclude, I'm going to hand over to Carol Philby, who is the person who is behind today's event, along with other colleagues, but also who leads on pulling together information on our local offer along with colleagues in the LA. So Carol, would you like to talk us through further avenues of support and just round up the Teams Live event for us this morning, please?
Thank you, Judith, no problem. Yeah, well, Judith stole a few of my lines in that last little paragraph, but just to say, as part of the local offer team, we are in the privileged position of being able to see all the hard work that's going on over lots of the different parts of the council. And the first thing I really want to say is that we know that this has been such an uncertain time for families. We know that stuff has been changing. Lots of us are parents ourselves, lots of us are journeying this as well. And as part of the local offer, what we can see more easily often than you is how much hard work is going on across all the different parts of the local authority. And I hope that this morning has served to reassure you that there are people who know their stuff, who are working really hard on the different parts of this. And we know that they're complicated. We know that often there isn't one good answer that's going to work for every family, but we are working really hard and trying to be as responsive and as open as we can to share up-to-date information with you as soon as we have it. So, as Judith said, in addition to the links that we've already mentioned, you can see on the screen now some more avenues of support that we thought we would put up that might be helpful to you. So on the Suffolk Local Offer website, we've been issuing periodic bulletins as we've been made aware of questions that families have had. Some of these questions have come directly to us. Some have come through Suffolk Parent Carer Network. Some have come through Sendias, and we're really grateful to them for their support. We've issued some FAQ bulletins, and they are really great detailed sources of answers, information and more resources. If you're anything like me, when you listen to something, you don't take it all in. But these are a great way of being able to read back through stuff at your leisure and click on some of the other avenues of support available. So we'll send that link out to you. We've also got pages on the local offer from many of the specialist services that you've heard from this morning. So our specialist education services have a page on there. Our psychology and therapeutic services, our dyslexia outreach teams, there's lots of different teams that have pages on the local offer, and they have all been hard at work trying to reimagine how their services work during the period of lockdown, and also working really hard with schools as to how we bring stuff back as September gets underway. So we'll send you the link to those specialist services. As Judith said, we know that school travel is a hot potato, and Suffolk On Board have published a wealth of information that I read often and find very useful. So we're going to give you a link to school travel information on there as well. Some other things you might find useful: Suffolk County Council are issuing general COVID updates as to the local picture of infection rates and our response plans and the wider services that they're providing, not just as part of SEND, not just as part of education, but the wider services throughout Suffolk. So that's always a good page to check if you have questions. They also have a back to school section on their website that, again, many of our specialist teams have had input into, and there's some really good resources on there. I've used some of them with my own children who are feeling a bit nervous about going back, and I think it's important to say that not every link, not every resource will be right for every family, and we know that, but we are publishing as much as we can, and we hope that something in there will be right for each of you where you're at the moment. We've also put some other external links in there. So we've put we've put a link to Sendias. Sendias are a great organisation who have so much knowledge, and they are running some back to school web sessions. I think the next one that still has spaces available is on the 8th. So we will send you out that link, and we'd encourage you to make contact with SENDIAS if you have any questions about this or any other aspects of SEND provision. Suffolk Parent Care and Network work tirelessly, we know, to support so many of you, and we are really grateful to them. So we're sending you out a link to their website. We're sending you out a link to some of the CCGs in the area, because we recognise that this is not just an education issue. There are often correlations that need to be tied up with health as well. So we've got those links for you. And some additional links. We had a question earlier about mental health support. And again, we know one size doesn't fit all. You've been telling us that, we've heard it. And we do have a tiered response from, as I say, resources that will help any family with a child who's just feeling a little bit anxious, right through to more specialist provision. So we've given you some links to our mental health support partners as well. At the bottom, I wouldn't be doing my job properly if I didn't give you a link to www.suffolklocaloffer.org.uk. That is our official website, where we try to give you a one-stop shop for all information to do with SEND in Suffolk. And if I could just have a click through to the next slide, please, Kylie. That next slide, as well as thanking you for coming, also gives you our social media accounts. And that really is the best way to keep up to date with what is happening. This year has been a changing year, and we know that, and we are trying to respond to you as consistently and quickly as we can. And one of the quickest ways we can do that is through our social media pages. So if you don't already, please follow us on Facebook, please follow us on Twitter. We know that it's been uncertain. We hope that this morning has shown you that information is out there, that specialist resources and knowledge are out there, and that they are on it. But if you have any questions, please don't hesitate to contact us. We don't want anyone to feel alone. We want everyone to feel supported. And if we haven't managed to answer your question this morning, or you've got another question, please get in contact with us. So thank you so much for coming. As Judith said, we'll make the questions and the answers and the links available to you. Thanks ever so much for coming, and speak to you soon. Bye bye.